and mobile devices to be set at the silent mode. In case of fires and undue emergency, kindly exit the auditorium in an orderly manner via the fire exit doors. Kindly adhere to the COVID prevention SOP as per directed by the Directorate and also the Ministry of Health, Malaysia. Let me see. Announcing the arrival of our guest of honor, Yang Berbahagia Tan Sri Datuk Seri Dr. Nur Hisham bin Abdullah, Director General of Health of Malaysia. Assalamualaikum and a very good afternoon. Yang Berbahagia Tan Sri Datuk Seri Dr. Nur Hisham bin Abdullah, Director General of Health of Malaysia, Yang Berusaha Profesor Dr. Yatimah binti Alias, Deputy Vice Chancellor, Academic and International, University Malaya, Professor Michael Griffin, President of Royal College of Surgeons of Edinburgh, yang berusaha Profesor Dr. Rosmawati binti Muhammad, Master Academy of Medicine of Malaysia. Yang berbahagia Datuk Dr. Bashir Ahmed Abdul Karim, President of Malaysian Association of Thoracic and Cardiovascular Surgery. Yang berusaha Profesor Dr. April Camilla Roslani, Dean, Faculty of Medicine of University Malaya. Guests, ladies and gentlemen, welcome and selamat datang to the ceremony of signing of Memorandum of Understanding between University Malaya, Royal College of Surgeons of Edinburgh, Malaysian Association of Thoracic and Cardiovascular Surgery, and Academy of Medicine of Malaysia. Without further ado, we would like to invite Dr. Harith Amir Rizal for the Dua recital.
Assalamualaikum warahmatullahi wabarakatuh. Al-Fatihah. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Hamdan syakirin, hamdan hamidin, hamdan yuafi ni'mahu wa yukafi mazidah. Ya Rabbana wa lakal hamdu kama yanbaghi li jalalika wa wajhika azimi sultanik. Allahumma innaka nas'aluka salamatan fid din wal afiyatan fil jasad wa ziyadatan fil ilmi wa barakatan fil rizqi wa taubatan qabla al-maut wa rahmatan indal maut wa maghfiratan ba'da al-maut wa najatatan minan nar wa afwa indal hisab. Ya Allah, ya Karim, ya Wadud, sesungguhnya kami berhimpun pada hari ini bagi menyatakan kesyukuran di atas kurniaan-Mu yang tidak ternilai. Jadikanlah kami hamba-hamba-Mu yang sentiasa bersyukur. Sama ada dengan nikmat yang sedikit, lebih-lebih lagi nikmat yang melimpah ruah kepada kami. Ya Allah, ya Rahman, ya Rahim, Engkau berkatilah dan rahmatilah perjalanan Majlis National Cardiothoracic Surgery Training, Memorandum of Understanding, and the launch of Cardiothoracic Surgery National Curriculum pada hari ini. Sesungguhnya, Engkau Maha mengetahui bahawa kami di sini ingin menimba ilmu-Mu yang sangat luas bagi mengembangkan ilmu pengetahuan kami sebagai hamba-Mu yang Engkau redai. Justru, berkati dan rahmatilah perhimpunan kami ini. Kurniakanlah kami ilmu-Mu, sinarilah hati-hati kami dengan cahaya dan hidayah-Mu. Semoga dengannya kami mudah menerima dan menghayati serta mengamalkannya. Ya Zal Jalali wal Ikram, kurniakanlah jua kepada kami kesihatan anggota, kecergasan minda, ketenangan jiwa dan kekuatan semangat. Semoga dengannya kami mampu mendepani cabaran, berdaya saing dan mampu mengangkat martabat diri, keluarga, masyarakat dan negara. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azaban nar. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wasallam. Walhamdulillahi rabbil alamin.
Thank you, Dr. Harith. We would like to cordially invite Yang berusaha Professor Dr. Yatimah binti Alias, Deputy Vice Chancellor, Academic and International, University Malaya, to deliver the opening speech. Yang berusaha.
Thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, good afternoon, Tan Sri, Datuk Sri, Dr. Nur Hisham bin Abdullah, Director General of Health Malaysia, Professor Michael Griffin, President of the Royal College of Surgeons of Edinburgh, Professor Dr. Rosmawati binti Muhammad, Master of Academy of Medicine Malaysia, Datuk Dr. Bashir Ahmad Abdul Karim, President Malaysian Association of Thoracic and Cardiovascular Surgery, Professor Dr. April Camilla Roslani, Dean of Faculty of Medicine, University of Malaya, ladies and gentlemen. We are here today to witness the signing of the Memorandum of Understanding between University of Malaya, Royal College of Surgeons, Edinburgh, MAT-CVS, and Academy of Medicine Malaysia for the Parallel Pathway Training Program in Cardiothoracic Surgery. We are also here to witness the launch of the National Curriculum for Cardiothoracic Surgery. So cardiothoracic surgery is one of the youngest surgical specialty. In Malaysia, the first open heart surgery was done in 1975 in University Hospital, now known as University Malaya Medical Center. Since then, the specialty has been slowly growing over time, and this is mainly due to the high burden of cardiovascular and thoracic disease nationally. So many centers have been developed since then, but there has been a huge deficiency in the number of cardiothoracic surgeons nationally. Traditionally, the surgeons were trained in apprenticeship-based module after they having completed their postgraduate training in general surgery. So this module of training takes a very long time to produce a cardiothoracic surgeon, and there has always been a deficit in the numbers of surgeons in the public sector. So realizing this, the Malaysian Association of Thoracic and Cardiovascular Surgery worked together with the Royal College of Surgeons of Edinburgh, Ministry of Health Malaysia, Institut Jantung Negara, Universiti Malaya, and Academy of Medicine Malaysia to start a structured training program for cardiothoracic surgery. So the Parallel Pathway Program was started in 2016 and has 28 trainees up to now. So we are proud to know that the vision of cardiothoracic surgery in Universiti Malaya is one of the best training center for this program. Equipped with 3 consultant cardiothoracic surgeons, they have been able to deliver high quality training for the trainees and give them a variety of exposure in all aspects of adult cardiac surgery. Minimally invasive cardiac surgery, minimally invasive and complex thoracic surgery, and complex aortic and endovascular surgery. They don't only excel in delivering clinical training, but also in running international training courses like the KL Review course and International Aortic Symposium. So with our huge commitment for academic and training, we feel privileged to be part of this historic MOU. Universiti Malaya will be the educational providing body for the Parallel Pathway Training Program in this MOU, and will work closely with all the stakeholders of this program to ensure that we produce a safe cardiothoracic surgeon for the nation. So under the terms of the MOU, training in cardiothoracic surgery through the Parallel Pathway will be jointly organized by the MAT-CVS, the AMM, and the Ministry of Health. The RSC Edinburgh will quality assure the 6-year structured training program and will provide the exit examination in cardiothoracic surgery. So successful candidates will be awarded fellowship of the Royal College of Surgeons of Edinburgh in the specialty of cardiothoracic surgery. So in line with structured training and standardizations of training opportunities, the National Curriculum for Subspecialty Training was started for all the major specialties in the country under the leadership of Professor Datuk Dr. Adiba Kamaruzaman. The National Curriculum in Cardiothoracic Surgery sets the training requirements for cardiothoracic surgery training in the country. So it is an important resource for both trainers and trainees in cardiothoracic surgery Malaysia. So the curriculum adheres to the standards set by the Malaysian Medical Council. So all cardiothoracic training programs in the country will need to meet the requirements in the national curriculum to ensure that safe and competent cardiothoracic surgeons are produced. So the National Curriculum in Cardiothoracic Surgery is an initiative of the Medical Deans Council and the Malaysian Association of Thoracic and Cardiovascular Surgery. So here, I would like to congratulate Associate Professor Dr. Siva Kumar Krishnasamy and his team, who has written the blueprint for cardiothoracic training in this country. So finally, I would like to thank all parties involved in making this event a success and also making it an important day for all those who are involved in the training of cardiothoracic surgery in Malaysia. Thank you very much.
Thank you, Professor Dr. Yatimah binti Alias. Next, we would like to cordially invite Professor yang berbahagia Datuk Dr. Bashir Ahmad Abdul Karim, President of Malaysian Association of Thoracic and Cardiovascular Surgery, to deliver his speech. Datuk.
Assalamualaikum. Bismillahirrahmanirrahim. Allahumma salli ala Sayyidina Muhammad abdika wa rasulika nabiyil ummi wa ala alihi wasallam. Terima kasih Puan Pengerusi Majlis. For the information of everyone, Puan Pengerusi Majlis is our consultant pediatric cardiothoracic surgeon in Serdang. And I'm quite proud to introduce her as the Puan Pengerusi Majlis. Yang berbahagia Tan Sri Datuk Dr. Nur Hisham Abdullah, Director General of Health Malaysia, Professor Michael Griffin, President Royal College of Surgeons of Edinburgh, Professor Dr. Yatimah, Timbalan Naib Chancellor Academic dan International Affairs, Professor Dr. April Kamila Roslani, Dean Faculty of Medicine, Professor Dr. Rosmawati Mohammed, Master Academy of Medicine Malaysia. It's with great honor and pleasure I stand before you today in this podium. It's actually a location of my own alma mater. I did my medical studies here in order to celebrate this occasion, which brings together major stakeholders in the practice of cardiothoracic surgery in Malaysia. This location is also meaningful because, as what Professor Yatimah pointed out, it's arguably the birthplace of cardiac surgery in Malaysia. Ministry of Health, the largest stakeholder of healthcare services in Malaysia and key administrator across all specialties, Royal College of Surgeons of Edinburgh, oldest surgical organization in the world, 505 years, dedicated towards training and promoting surgical excellence across the globe. Academy of Medicine, leading institution for professional and postgraduate education across all medical specialties in Malaysia. And of course, University of Malaya, who is long known for tradition in excellence of postgraduate medical care through master's program, with her philosophy of research and training activities. And Malaysian Association of Thoracic and Cardiovascular Surgery, the sole organization representing cardiothoracic surgeons in this country. In that spirit, just allow me a few moments to share with you my thoughts on the development of this training program. Surgical training in all specialties in Malaysia has always been apprentice-like. Rather subjective, call it chronism if you may. It usually depended on a few senior surgeons who have a godfather-like mentality. And if you want anything and you want to get into a training program, you need to go and perhaps buy him the nasi lemak in the morning and probably offer to drive his car, and run some errands at the supermarket for him. Now that was the attitude and culture for many years. But in the 1980s, this approach met its challenge for the first time with the introduction of masters in surgical training programs in our local universities. For starters, training suddenly became more structured, appraisal-based, exam-oriented. Parameters of research, logbook, and all that was introduced. Universities, primarily UKM, and USM, provided most of the programs. Master's program beautifully addressed our shortage of specialists in various specialties in this country. But there was a problem with cardiothoracic surgery. Cardiothoracic surgery did not have a master's program, remained as apprentice-like even after the 1980s. The problem is that any cardiothoracic surgical program, which needs to be, if we want to set it up, it must be carefully matched with patient volume. It must be carefully matched with complexity of cases, number of trainees, number of trainers, and not forgetting, of course, the needs of the country. These factors began to limit training positions, and we found that we couldn't churn out cardiothoracic surgeons quicker in a more efficient manner to address the country's needs, especially the burden of chronic diseases of diabetes and hypertension leading to heart disease. Number of positions became limited across all specialties in 2017. there were only about 800 to 1,000 posts of trainees being offered in the master's program. The MOH or KKM realized that the goals of better healthcare for the nation cannot be met by these efforts alone. In 2016, can I have the slide? In 2016, the DG of Health responded to public inquiries on this topic and declared that KKM will continue to explore other training pathways to increase number of specialists in the country. This moment was probably the birth of the concept of parallel healthcare program. If you notice, in that report, the DG refers to letters published in the Star on 22nd, 23rd, and 24th March. He was actually responding to public complaints that the number of specialists in this country who are being trained is still not enough. So then we as a fraternity responded to the Director General's call with some pioneers and senior members who grouped together with the support of our old-time friend, colleagues from Royal College of Surgeons in Edinburgh. We have had a long, fruitful relationship with them, and we also looked into similar regional collaboration programs, and which included the strength of all players, namely KKM, universities, and Institute Jantung Negara. We felt that this was the way to go from the old model, get more junior officers to join the program early, have entry and exit exams, quality assured by our foreign partners, and completely objective recruitment and graduation process so that they don't have to drive their boss's car to get into a training program. Lots of meetings, planning and bureaucracy, credentialing of centers. The first group of trainees were recruited in 2016. As I might share my personal experience, I didn't think that all this was about trainees alone. It was a lot about trainers as well. I realized that we needed to be educated to be trainers. While we were training, it was a complete new learning experience for me. I needed to control my desire to take over the operation from my trainee. I need to learn to patiently watch him struggle and accomplish the surgery in a slower manner. Now that required a lot of self-control on my part. We also had to ensure teaching activities are lively in the department. Realize that teaching can be done informally anywhere, while you're having coffee, while you are probably in the changing room, etc., etc. We realized we actually sat down and organized an MCQ question bank. We actually sat down and talked about the curriculum. This is not very easy because surgeons, being surgeons, generally have very big egos. So it's quite difficult and a challenge to put a group of surgeons in a room to decide on MCQ questions and curriculum with lots of arguments. But then that was a good process because I think the best outcomes are we usually get the best outcomes when completely contrasting arguments are put up in a clear manner on the table by all the parties who have differing views. So that's when you have the best results. I also had to learn from my trainees and how to address them. I had to give them tutorials on when to call the consultant when you have the problem during surgery. Last week, I thought I'll just share this. So I used to tell my trainees that you got to call the consultant when you have bleeding in the aorta, you got the heart, myocardium is torn apart, or the patient is not stable, and so on. So we had a long list where we give to the trainees to call the consultant immediately when you face these problems in the theater. So last week, my trainee called me after I left the theater and said that he can't find a gauze inside the pleural cavity. So, because he's too afraid to explore the pleural cavity. So then I decided that we have to give him a tutorial on when not to call your consultant. So that's all part of the learning process. Well, anyway, I'm quite proud to share that the first group of trainees, just quickly to go through, the first group of trainees are due for the exams in May 26 this year. We hope and we sincerely aspire to have our new group of surgeons among us as soon as possible. It has been a great roller coaster journey, not only for the trainees, but for all of us. Lots of learning and reflection accumulated over the process. Lastly, I would like to thank University of Malaya Deputy Vice Chancellor, Professor April, Dean of Faculty of Medicine, for your unwavering support in joining this great collaboration, which I'm sure will be fruitful in the near future. I would like to also thank Ministry of Health and KKM and Tan Sri DG himself, for if not for your idea of parallel program, we will not all be here this afternoon. And I think I would bank on your continued support to run this program so that we can churn out safe cardiothoracic surgeons for the Rakyat. Let us hope that with the launch of this curriculum and signing of MOU, cardiothoracic surgical training is enhanced with good quality assurance, further improved to provide and ensure surgeons of the future are competent, skilled, have adequate knowledge, and most importantly, make safe decisions for our Rakyat when it comes to cardiothoracic care. Surgeons will always be leaders, and I believe good leaders don't just create followers. Good leaders create more leaders. In that spirit, I think good surgeons should train more good surgeons. Ladies and gentlemen, thank you very much.
Thank you, Dr. Bashir. We would like to further invite Professor Michael Griffin, President of Royal College of Surgeons of Edinburgh, to deliver his speech. Professor.
Ladies and gentlemen and honoured guests, it is an absolute delight to be here back in Kuala Lumpur, one of our favourite cities of the world, certainly personally and from a college perspective, the Royal College of Surgeons of Edinburgh. And I just want to mention a few key people who have brought this momentous day to come to pass. And first of all, I would like to thank Professor Dr. April Raslani, who's, I was going to say an old friend, but a young friend, really. A young friend, but we've known for some time, and who is an honoured fellow of the Royal College of Surgeons of Edinburgh, and who's really been instrumental in the development of the college here in Malaysia. Also, I'd like to welcome and pay tribute to Dr. Fatima Alias, who's the Deputy Vice Chancellor of the University of Malaysia, and also someone who I met today for the first time, Dr. Rosmati Muhammad, who's the Master of the Academy of Medicine in Malaysia. It was lovely to meet you this morning. And we've just heard from Dato Dr. Bashir Ahmad, a great speech there, highlighting just what advances have been made in this training program. And finally, I just want to pay tribute to Tan Sri Dr. Nur Hisham Abdullah, who is our DG, Director General, who without your support, this would not have happened. Now, this program of training, we must not lose sight of why this has happened. It is about patient outcomes. This is not about politicians' outcomes. It is not about surgeons. It is not about their personal preferences. This is to provide the next generation of surgeon, and in particular, cardiothoracic surgery. And there were times, both in the United Kingdom and here in Malaysia, where outcomes for patients were poor, and still, cardiothoracic surgery is underrepresented with the number of consultants and the number of surgeons providing this care. There still needs to be expansion of that cohort in order to improve outcomes for patients. And what this wonderful scheme that has been set up with the support of the Academy of Medicine of Malaysia, the support of the Department of Health, and with the support of the Royal College of Surgeons of Edinburgh, and of course the Cardiovascular Society, this has brought about structured training. It is brought about training that is quality assured from the day it started to the day it's finally assessed by examination. So what we have now is a curriculum, and that curriculum is mapped very similarly to the curriculum that has been so successful in the United Kingdom, but most of all, it has been tailored for Southeast Asia and Malaysia in particular. The training program, the same, mirrored from the experience that we've had in the United Kingdom, but tailored to the needs of Southeast Asia. And, of course, the exam and the assessment process, which is absolutely mapped to that blueprint of the curriculum and training. In other words, it is quality assured all the way through with all the expertise that we have from our history. And I would remind those in the audience that don't know that the Royal College of Surgeons of Edinburgh are 517 years old, and it has always stood for maintaining standards of education and training in order to improve patient outcomes. And this is the perfect example of how training, a good training program, will improve outcomes for patients. So we are absolutely honoured to be part of this wonderful program, which is going to deliver safe surgery for the people of Malaysia. Absolutely delighted to be here, and it's an honour to have something really, really tangible to do to improve those outcomes. So thank you very much indeed.
Thank you, Professor Griffin. Next, we would like to invite Yang Berusaha, Professor Dr. Rosmawati binti Muhammad, Master, Academy of Medicine of Malaysia, to deliver a speech. Professor.
Thank you very much. Yang berbahagia Tan Sri Datuk Sri Dr. Nur Hisham Abdullah, Director General of Health Malaysia, Yang Berusaha, Professor Dr. Yatima Alias, Deputy Vice Chancellor, University of Malaya, Professor Michael Griffin, President, Royal College of Surgeons of Edinburgh, Yang berbahagia Datuk Dr. Bashir Ahmad, President, Malaysian Association of Thoracic and Cardiovascular Surgery, distinguished guests, ladies and gentlemen, Assalamualaikum, and a very good afternoon to everyone. The Academy of Medicine of Malaysia is extremely delighted as well to be part of this National Cardiothoracic Surgery Training MOU. Now, the Academy, embracing 12 colleges and 24 chapters, has gained recognition as the only organization that represents all medical specialties in this country. And it's working very closely with the Malaysian Medical Council in matters pertaining to specialist recognition, training, as well as continuous professional development. So while the standards and the recognition by MMC provide the regulatory framework, the training providers from the specialty or the profession itself will need to provide or give important input and provide oversight with regards to the delivery of training. And the Academy, with a proportional representation of office bearers from both the public and the private sector, is therefore in a very unique position of having the ability and experience to combine resources and expertise from the Ministry of Health, the universities, the professional societies, as well as the private sector. So the new Cardiothoracic Surgery Training MOU has clearly stated the commitment by the RCS Edinburgh, MedCVS, and AMM to work together to maintain the high standard of cardiothoracic surgical practice through education, training, and assessment. So the inclusion of University of Malaya as the higher education provider in a new MOU will not only ensure the sustainability of the training program in Malaysia, but also provide a certificate of completion of training to trainees who have completed the cardiothoracic surgery training program and are successful in the Joint Specialty Fellowship examination of the cardiothoracic surgery. Now, this is important because the provisions of the new MOU will therefore be very much aligned with Section 14B of the Amended Medical Act, which states that in addition to holding a recognized specialist qualification, he has attended specialized training in the specialty in a recognized training institution. So I'd like to congratulate the Cardiothoracic Surgery National Curriculum Committee for paving the way to provide a unified and structured curriculum for cardiothoracic surgery training in Malaysia. It was already before present, but now being formalized. And this is a tremendous achievement in just a matter of months. And the national curriculum for cardiothoracic surgery training represents a historical milestone, as it's in being the first training curriculum initiated by the parallel pathway, unlike the national postgraduate medical curricula for the 23 specialties initiated by the master's programs under the Dean's Council. Which then this was launched last year in August, and I think we actually had seen the 12 specialties that were launched last year. So the composition of the Conjoint Committee for Cardiothoracic Surgery Training will ensure that training is a collaborative effort of the Ministry of Health, MedCVS, the universities, and AMM, who are also representing the private sector, and will facilitate cooperation between all education training providers, and therefore will allow the maximal utilization of the expertise and facilities available in the MOH, the universities, as well as the private institution. Lastly, continued external quality assurance has been already mentioned, undertaken by the Royal College of Surgeons of Edinburgh, will definitely enable the Conjoint Committee of Cardiothoracic Surgery Training in partnership with RCS Edinburgh to ensure that the structured supervised training is in place based on the MMC standards for medical specialist training. With that, thank you.
Thank you very much, Prof. Now we would like to invite our guest of honor, Yang Berbahagia Tan Sri Datuk Sri Dr. Noor Hisham Abdullah, Director of General of Health of Malaysia, to deliver his speech. Tan Sri.
Thank you, Madam Chairperson. Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala ashrafil mursalin wa ala alihi wa sahbihi ajma'in. Yang berbahagia Profesor Dr. Yatimah alias Deputy Vice Chancellor University of Malaya, Professor Michael Griffin, President of the Royal College of Surgeons of Edinburgh, Professor Dr. Rosmawati Mohamad, Master of the Academy of Medicine Malaysia, Yang berbahagia Datuk Dr. Basir Ahmad Abdul Karim, President of the Malaysian Association of Thoracic and Cardiovascular Surgery, Professor Dr. April Kamila Roslani, Dean, Faculty of Medicine, University of Malaya. Ladies and gentlemen, first and foremost, the signing of the Memorandum of Understanding today between University of Malaya, the Malaysian Association for the Thoracic and Cardiovascular Surgery, the Academy of Medicine of Malaysia, and the Royal College of Surgeons, Edinburgh, is a historic milestone for the country. It is a continuation of the MOU previously signed in 2014. The new MOU will strengthen the training pathway, ensure the highest standards, and meet local regulatory requirement. And I want to thank and congratulate all parties for working together to make this possible. If there's anything that we have learned from this pandemic COVID-19, is to come together and work as a team. I would also like to congratulate the Cardiothoracic Surgery fraternity led by the Malaysian Association for Thoracic and Cardiovascular Surgery for the enormous progress made in organizing structured training in cardiothoracic surgery in the country through the parallel pathway over the last 6 years. The Ministry of Health is delighted to support this training pathway, which ensures training to be of higher standards in cardiothoracic surgery and quality assured to the international standards by the Royal College of Surgeons of Edinburgh. In 2030, Malaysia's population is expected to have approximately 2 million additional persons older than 65 years of age, with an estimated 10% increase in the disease burden. Consequently, the number of patients requiring heart surgery is expected to follow. Even with the current 68 cardiothoracic surgeons performing adult cardiothoracic surgery in Malaysia. The Ministry of Health cardiothoracic centers are registering 1,905 patients awaiting for surgery as of 31st of March 2022. To overcome this, the Ministry of Health has initiated multiple strategies, including engaging with all the universities and private hospitals to clear the backlog of cases. The Ministry of Health is looking for further strengthen the collaboration by partnering with the consortium of public university hospitals in providing coronary artery bypass graft services to the underserved group of patients. Ladies and gentlemen, there are now 28 trainees undergoing cardiothoracic surgery training through the parallel pathway, 17 from the Ministry of Health, 8 from the IJN, 2 from the University of Malaya, and 1 from Brunei through a special arrangement G2G. The first batch of trainees will be having their exit exam soon, and hopefully it will be awarded the fellowship of the Royal College of Surgeons if they pass by June this year. Malaysia is also experiencing a lack of pediatric cardiac surgeons, likewise and the rest of the world. Currently, only 7 full-time cardiothoracic surgeons are performing pediatric cardiac surgery, and there has been only 1 new pediatric cardiothoracic surgeons produced over the last 10 years. With the signing of the MOU, the Ministry of Health Malaysia also envisioned having more cardiothoracic surgery trainees would be trained in pediatric cardiac surgery. The Malaysian Association for Thoracic and Cardiovascular Surgery Workforce Planning Report projects a need for additional 40 additional cardiothoracic surgeons in Malaysia in the next 5 years. Following the strategic partnership and collaboration with Royal College of Surgeons, Edinburgh, we are expecting to meet this target, including 45 additional cardiothoracic surgeons through training pathway locally and abroad. The COVID-19 pandemic has transformed how the world perceives healthcare services. The Ministry of Health is currently reviewing its cardiothoracic surgical operational policy regarding facilities, equipments, human resource, referral patterns, and scope of services in line with the new norm in the post-pandemic era, while ensuring equitable access to quality surgical care. The Malaysian Association for Thoracic and Cardiovascular Workforce Planning report would serve as an essential guide when formulating the new cardiothoracic surgical operational policy. We must produce safe and competent cardiothoracic surgeons so that patients who require heart, lung, and chest surgery will receive the best care for their conditions. And hence, the national curriculum in cardiothoracic surgery will see the country's standards and requirement for cardiothoracic surgery training. It will also be essential as a referral pattern for the trainers as well as the trainees in the cardiothoracic surgery and meet the needs of the national curriculum. I understand that it's not easy for us to bring all parties together, and there's a lot of negotiation and in terms of challenges that we have faced. But more importantly, I think the role of Ministry of Health to get people together. And I think this is very important. One of my role is to massage the ego of the surgeons and the clinicians. And this is very challenging, but at least now we can see the fruitful engagement that we have over the years have actually give us a good beginning. So before I conclude, I want to congratulate the Malaysian Association for Thoracic and Cardiovascular Surgery, the University of Malaya, the Medical Deans Council, and the Royal College of Surgeons of Edinburgh. The Ministry of Health believes that this strategic partnership will strengthen the Malaysian healthcare delivery system and improve the country's health quality. More important, this is indeed a new beginning, a new partnership towards equitable access of sustainable quality healthcare in our country. With that, ladies and gentlemen, thank you all for your attention. Thank you.
Thank you, Tan Sri. For our next session, yang berusaha, Professor Madhya Dr. Sivakumar Krishnasamy will be presenting an excellently curated montage of the training program, followed by an official launch of the national curriculum. Prof. Siva?
Thank you, Ms. Laura. Yang berbahagia Tan Sri Datuk Sri Dr. Nur Hisham bin Abdullah, Director General of Health Malaysia, Professor Dr. Yatimah Alias, Deputy Vice Chancellor, Academic and International, Representative of the Vice Chancellor, University Malaya, Professor Michael Griffin, President of the Royal College of Surgeons of Edinburgh, Professor Dr. Rosmawati binti Muhammad, Master of Academy of Medicine, Malaysia, Dato Dr. Bashir Ahmad Abdul Karim, President, Malaysian Association of Thoracic and Cardiovascular Surgery, Professor Dr. April Kamila Roslani, Dean, Faculty of Medicine, University Malaya. Ladies and gentlemen, the National Postgraduate Medical Curriculum, NPMC, for cardiothoracic surgery has been a very long journey for all of us. The initial initiative started off in early 2019 under the guidance of Prof. Dr. Adiba, and by the support of the MOU team. However, there was a lot of dispute, and later on, end of 2019, Prof. April again reinitiated this for us in a meeting we had together with her, as the president of the College of Surgeons. Work started to move on, but however, it was stalled again due to the COVID pandemic. And subsequently, over the last year or so, we started to get our act together, and we all sat together and got the curriculum going. The National Curriculum for Cardiothoracic Surgery is the culmination of collaboration between all cardiothoracic surgeons who are practicing in the Ministry of Health, Ministry of Higher Education, Institute Jantung Negara, and private sector. It provides a structured and unified curriculum for the training of cardiothoracic surgeons throughout the country, aligned with the National Strategy for Healthcare. The standardization of cardiothoracic surgery specialist training for Malaysia will drive forward high quality, effective, and safe for patient care. All CTS training programs in Malaysia should conform to the minimum requirements described in this document and subsequent editions when they become available. Every care has been taken to make sure that the information in this document was accurate at the time of publication. The curriculum will be reviewed and revised over time at regular intervals in keeping with advancements in surgical practice. I would personally like to thank and take this opportunity to thank Prof. Dato Adiba, Prof. Sharul Baya, Prof. Jamuna, and the MOU team for the untimely advice and consultation, even at very odd times and over the weekends, and joining us for Zoom meetings or even in person for some of our retreat. A special thank you to Prof. April, our Dean of Medical Faculty, for continuous support and guidance for this project and also for the MOU today. Without her support, all this wouldn't have been possible. And also a big thank you to the Malaysian Association of Cardiothoracic and Vascular Surgery, council members and President Dr. Bashir, who made this event also possible with the support of the society and also the curriculum writing. I would also like to thank the Department of Surgery and the Cardiothoracic Division and all my registrars and MOs who have been here to help us out in making this event a success. A lot of effort has been put to make sure this event happened well today, and for that, I would like to thank the Faculty of Medicine, the International Unit FOM, Visibility Unit of Faculty of Medicine, and also a lot of work that was done by Zura, Sofwan, and team. With that, I would thank everyone, and I would end this with a montage presentation. The montage, please. The sound.
My opinion for this CDC training program is a good and comprehensive training program. It's well covered, well structured and holistic programs with thesis training over the course of 6 years, and you get to rotate to different training centers along the way.
I think it is a well-structured program, holistic, and we had a lot of training to become competent
the consultants here are very good because they allow us to do things related to cardiothoracic surgery, and they guide us in order to do that.
Excellent cardiothoracic surgery training center because it provides us as a trainee with a variety of cases and a variety of physical procedures.
It is completing currently a fourth-year cardiothoracic training attached to the University of Malaya Medical Center, working under Prof. Shahrul, Prof. Siva, and Prof. Daniel. So, my general experience at this hospital has been very positive. The case mix is excellent. We've got a wide range of surgeries that are performed here, including complex cardiac surgery and thoracic surgery.
Hi, my name is Ashwin Nair, and I'm a final year cardiothoracic surgery trainee at University of Malaya Medical Center. And I've thoroughly enjoyed my training experience here through the years, whereby we get to work with different specialties, and it's been a robust and exciting journey, whereby the training is quite comprehensive, and we get a lot of hands-on experience in managing patients and also enhancing our operative skills. So at the University of Malaya, I've been exposed to a variety of cases, including complex cases such as aortic arch replacements, and also minimally invasive cardiac surgery such as minimally invasive valve surgeries, and also uniportal VATS thoracic surgery.
We have also excellent colleagues who have been helping us and doing all the works and also the IC reports for us, and we are really appreciative. So for UF training, it has been really a good opportunity to have the chance to come, and it's really great to work here for the past 1
Thank you for the excellent montage. We would like to invite Yang Berbahagia, Tan Sri Dato Sri Dr. Noor Hisham bin Abdullah, to officiate the launch of the national curriculum. Thank you, Tan Sri. To officiate the signing ceremony, we would like to invite the representative Deputy Vice Chancellor Academic and International University Malaya, Yang Berusaha Professor Dr. Yatimah binti Alias, President Royal College of Surgeons of Edinburgh, Professor Michael Griffin, Master of Academy of Medicine of Malaysia, Yang Berusaha Professor Dr. Rosmawati binti Muhammad, President of Malaysian Association of Thoracic and Cardiovascular Surgery, Yang Berbahagia Datuk Dr. Bashir Ahmad Abdul Karim. This signing ceremony will be witnessed by Yang Berbahagia Tan Sri Datuk Sri Dr. Noor Hisham bin Abdullah and also Yang Berusaha Professor Dr. April Camilla Roslani. Thank you very much. We wish the distinguished guests to kindly remain on stage for a photo session after the signing ceremony. Thank you very much. We wish for the distinguished guests to kindly remain on stage for photo session after the signing ceremony. We would like to invite the trainees for the photo session, please. Thank you everyone. Kindly remain seated. We would like to invite Yang Berbahagia Datuk Dr. Bashir Ahmad Abdul Karim to present a small token of appreciation to our guests on behalf of the METS ACVS and Professor Michael Griffin on behalf of the Royal College of Surgeons. Professor Michael Griffin will be giving a token gift of appreciation to the rest of the representative too. Yang Berbahagia Tan Sri Datuk Sri Dr. Nur Hisham Abdullah, Yang Berusia Profesor Dr. Yatimah binti Alias, Yang Berusia Profesor Dr. Rosmawati binti Muhammad, Yang berbahagia Datuk Dr. Bashir Ahmad Abdul Karim. Yang berusaha Profesor Dr. April Camilla Roslani. Thank you, ladies and gentlemen. We have come to the end of the MOU signing ceremony. The committee would like to express their gratitude to our guest of honor, Tan Sri DG, and the distinguished guests for making time to grace the ceremony and making this a memorable event. We would like to end with a massive thank you from everyone. Thank you.